Hello, welcome to round 4. Today is Wednesday the 13th of October and we've had a little bit of a busy day today. So my morning started off with an appointment with the radio oncology team this morning, the people who do the radiation, and we discussed what the treatment on their side would look like. So tomorrow is round 4, which also is the end of cycle 2, and at the end of cycle 2, sometime in the next 2 weeks, I will be getting a PET scan done just to see how my body is responding to the chemo. If my body is responding to the chemo as we all hope, then from there I will be completing another 2 cycles, followed by 3 weeks of daily radiation, which might sound like a lot. However, the doctor today was saying that it used to be 6 weeks of radiation, so 3 weeks is pretty good. He also basically drew out all of our conversation today, so we did a lot of thorough conversation. So basically, one of the other things he said today is with Hodgkin lymphoma, back in the day, he was saying in the olden days, in historical times, generally the course of treatment was just 6 cycles of ABVD, which is 12 rounds over 6 months. But then actually before that, this was simply treated with radiation alone. And then over time, doctors and scientists and all other people involved in medicine discovered that Hodgkin lymphoma responds best when it is given a bit of both. So some chemo and some radiation. So yeah, if all comes back good, it's another 2 cycles and then 3 weeks of radiation. So with the radiation, to prepare for that, the radiation has 2 parts to it. So the first part is planning. So basically with that, I get another CT scan, PET scan, another kind of scan, just to see what the body looks like at the end of treatment. And then basically they put that on top of an old scan of mine to see where the cancer was. And then basically they use that to line up, this is my understanding, use that to line up the machines so that the beams, the radiation beams, go straight to the affected area. So with the radiation, he's saying that that's designed to kill off any leftover microscopic disease. So things that you can't see on a scan. So yeah, planning. He said that I'll be getting 3 little dot tattoos just to help with lining up the machine each time I go in. And I think that was it for the planning side. He said that generally takes about 10 days to come up with the actual plan of the machines and whatnot. And then from there, it's just the treatment. So the 3 weeks of daily treatment. So I've got a phone call scheduled with them on Wednesday, day before next chemo. I think it's the 3rd of November. I'll be hearing from them. So I'm really hopeful that this PET scan will be good news. One of the biggest things that I've noticed is I can lay on my back comfortably now, which I couldn't do before. So I'm very, very hopeful that it's working, because if it's not working, I'll be a bit sad. But if it's not working, then I'll basically just escalate to 6 cycles of ABVD if it hasn't responded as much as we'd hoped. Otherwise, I get put onto a different regime of drugs altogether. So yeah, that's that. And then I had my blood test. I ended up waiting just over an hour for my blood test, which was a little bit annoying. I've got my cardigan on backwards, so it's a bit warmer on the couch. Yeah, blood test, but she was able to get a vein. I thought they could use my PICC line. The doctors that put it in said that the hospital would be able to use it for blood tests. And then when I got in there, she's like, no, we can't do it. It has to be done in the day ward, which is where I go for chemo. But no one told me that. So I got stabbed today. But thankfully, I didn't actually feel the stab. And it was done in my right arm today, which doesn't really get stabbed often. So I think because there's no scar tissue in there, it was relatively pain-free. Anyway, that was good. And then it was time for my gym session, which went very well. Let out some frustrations, and it was a good session. We did some bike work, we did some glutes work, so my butt felt that today, and some arm work, and yeah, it was just pretty good session. I was nervous about doing any arm work with the PICC line, but that all went relatively well. I was able to do, like, you know, your little weights this way, and that didn't bother me. But then there was some where you kind of like pull down like this. I couldn't do that because it just felt wrong. But yeah, that's it for my day today. So I'll see you tomorrow for round 4. Tomorrow's actually going to be a bit of a long day as well. Tomorrow morning I have my abdominal ultrasound before I have chemo. So wish me luck for that. Goodbye. Round 4, in other words, cycle 2 is complete. So today I started off with my ultrasound on my abdominal area. I got there about, I think, 5 past 8 or something, and my scan was at 8:30, and I think I was in there for about 45 minutes. I also had a lovely lady training, so she was having a good look at my insides. She spent a lot of time on my right side, and she ended up calling in, I don't know, someone higher up from her, like someone who's got their, I don't know, qualification or whatever. And she was having a look as well, and she was pushing in and getting her pictures and things, and was asking like if I had pain in this certain area. I was like, oh, a little bit, I don't know. And she goes, okay, well, you've got a few gallstones. I was like, okay, fabulous. So is that the reason I've been in all this like pain in my abdominal area? Like, and she said that, you know, it's a good possibility, and gallstone pain can kind of radiate in towards your midsection and stuff. So it's kind of nice to know that I'm not completely crazy and there is some pain going on, and it's not chemo related, but then at the same time, it might not be the gallstones. So I don't know if there's going to be any more like further investigations. We just kind of have to see how it goes from here. But on my referral form that my doctor sent, it just said to kind of check for gallstones, and that's what they did today. I feel a bit out of breath today. So yeah, I was saying that because all of my abdominal pain was like at the front, like basically from the bottom of my sternum to kind of the end of my belly button in that area, not the sides where the gallstones are. And she said that like up there, like where that pain was, she was saying that's where like your intestines and things are, and they don't, like their equipment or whatever couldn't see that far in or something. I don't know. So I don't know if my intestine area is fine. I don't know. But that's that. So I've got the gallstones. And the way that they explain that is it's just little deposits of things like cholesterol that your body couldn't digest properly or something. So we're just gonna wait and see what happens with them. We're not gonna do anything with them. But obviously if it gets worse, then we got to check in and got to try avoid surgery, because having surgery through chemo is not recommended for obvious reasons. But I think that's it for that. Then I also had to fast for that, so by the time I got there I was so hungry, so I'm glad I made myself a little sandwich before we left. It was cashew spread and jam, which I was eating as my nurses called me in to start chemo. Chemo today, thinking about it, made me feel like everything went fine, and the PICC line, I got redressed and flushed. I can taste everything like in the back of my throat, and just thinking about the drugs and everything is just making me feel really really sick, no matter where I am, what time of the day it is or anything. So it's already hit that point, but that was all fine. Yeah, that's it. There's nothing else to mention about that. The last week and a half, Hazel's had a cold, so she hasn't been to daycare at all. So trying to, look after her and look after me whilst keeping some kind of distance from her this week and a half has been very challenging. And I've gotten very good at knowing when she's about to cough so that I can, turn away, or if she's about to sneeze. I know it's not going to do a whole lot, but when we're really close, I'm kind of just, chilling there with my hand on my shirt over my face. I haven't allowed her in my bed to avoid any kind of infection from her to stay in the bed area, and just being really careful with food so that she doesn't come into contact with my food. And it's just been, it's been madness. So I've had the last 2 days with yesterday doing my the gym, the blood test, and the radiotherapy appointments. My older sister and niece were looking after the little madam, and today my niece was meant to be coming to chemo with me today, but stayed home to look after Hazel whilst I was getting my chemo, so I was all on my lonesome today. But no, that's alright. Didn't really bother me, and today went pretty quickly. But yeah, so I'm already feeling a little bit like tired and just nauseous. When I got home today, I had some lunch and that literally went straight through me, and I've been to the loo twice now, so that wasn't really fun. And yeah, we'll just see how I go. I'm also going to try and do some videos throughout the fortnight so that you don't end up staring at my head for 20 minutes like you have in the last 2 videos. So with that, I'm going to say goodbye, and I will see you in a few days. So bye. Hello from my car. I thought I'd just do a little update whilst I'm alive. Today's Monday. It's 4 days after chemo, and basically first 2 days I was feeling not too bad, but then yesterday and today I've just been feeling very, very exhausted, very tired. My taste this time has been really weird. I don't know how to explain it, but there's just like this really gross taste in the back of my throat, and food tastes a little bit different, and water just tastes gross. So keeping fluids up at the moment is a little bit difficult. My neck for some reason has been really itchy. I don't know what that is, if it's related to chemo, if it's something completely different, I don't know. My pick, we redressed it day of chemo, and we had to put a different dressing on it because my skin was starting to react to the other one. It's not giving me as much grief, and showers are definitely a lot easier. I remember my first shower with it a month ago was just horrendous. Like, I put my little sleeve thing on to keep it from getting wet, and it was still fresh from being done, and just I couldn't move my arm. I was paranoid about getting it wet, and just it wasn't very good. And then a couple of showers later, what I say to my family was I showered like a peasant. So I taped up my arm in the plastic wrap and showered at the sink. Well, my underarms, that is, which worked a lot better. And then I did my lower half in the shower. But now, because there isn't really any pain left in my arm, showering isn't too bad. Still trying to maneuver is a little bit awkward, but nothing like it was. My tongue is a little bit tingly, and if you see the whiteness, it's bloody gross. I don't like tongues and mouths, and just the thought of everything is disgusting. So when I look in the mirror and I see my tongue is white, it's just gross because it's a build-up of dead skin cells stuff, dead mouth stuff. So it just makes me yuck. And then sometimes if we really want to get into it, my doctors at the hospital like this analogy. You know when you're preparing some raw chicken from the freezer and it's not quite fully defrosted, so you put it in the microwave and then the edges get a bit too cooked, so you've got fleshy white chicken with some, fleshy pink chicken with white chicken on the edges? That's what my tongue looks like sometimes, and it's disgusting. Another thing, I mentioned it earlier on, is just this constant feeling of nausea related to the thought of saline. And I don't know why, but my brain every now and then just thinks about the saline, and then it makes me gag, and just smells like putting on my sleeve wrap and taping it up. The smell of that makes me feel sick, and just sometimes watching telly when I see IV lines and things, that makes me feel really sick. So that's just clearly not fun. Still bald. It's getting even less. Well, it was patchy beforehand, but now it's even more patchy. And my eyebrows are starting to look a wee bit patchy. Hello and welcome back to another video in my car. I started editing this whole thing and I don't know what happened in the last clip, but I somehow stopped recording because I know I was talking about other stuff, but what stuff I was talking about, I don't know. But anyway, a little update of how I've been going. Fine, pretty good, but the last, apart from yesterday, the 2 or 3 days before that, I had some bad stomach cramping again, which wasn't very nice. But other than that, touch wood, I'm okay now till Thursday. Other than that, this fortnight has been okay. So yeah, just a little update on that. I got a phone call today about my PET scan, so I'm going in tomorrow at 2 p.m. for the PET scan. So she said no sugar tomorrow, and I need to have something like toast for breakfast, which is fine, but then the PET scan is at 2 o'clock, so I have to fast till 2 p.m. after breakfast, which isn't too bad. And then just water, because I can't have sugar, because the injection they give me is that sugar, glucose stuff that, oh my god, goes to the areas of high activity. So yeah, that's that. I was meant to have a hematology appointment tomorrow with my doctors at 3 p.m, but the whole process of the PET scan takes 2 hours, so I have to cancel that and reschedule or something. But yeah, that's about it. I'll probably do a little update tomorrow after the PET scan, and that's it. Alrighty, see you later. So there's been a hold up or a problem with the patients. So my PET scan was scheduled for 2 o'clock. It's now 2:35 and I need to wait 45 minutes before I get the injection. So it's gonna be almost 2 hours before I get my PET scan. But I've been stabbed to check my blood sugar levels. They're fine. And there's the little hole in the wall. Got some pears to look at, and now I'm going to be sat here for a little while. Marvellous. Hello, quick update from yesterday. Got to the nuclear medicine place alright and signed in fine, and ended up waiting half an hour. So my appointment was at 2 p.m. and I was in the waiting room for about half an hour before they called me in, and the nurse flushed my PICC line ready to have the whatever that injection is called. And when he went to flush the saline, I asked if he could just do it slowly because I could taste it, and he looked at me and kind of went, hang on, and he got rid of the saline he had, and then he filled it with like a new saline. So the usual saline that they do with the syringes, it already comes pre-packaged and everything, so it has a lot more salt than whatever he used. So these come in like little, they almost look like the eye drop saline things. So he just filled a syringe up with that, flushed it, and didn't taste anything. So that was a positive out of last night, or yesterday. And then I was taken to my little chair where I'd get the injection, so the little cubicle with the darkness and the blinds and everything. And then another nurse came and saw me and was like, we've got a 45-minute delay because there was a patient before that. I don't know what happened, just all I know is there was a 45-minute delay. And then so I sat in my chair for 45 minutes, bored as shit, just scrolling aimlessly on Facebook and Instagram, and I don't know, reading stuff, and I don't know, I can't remember what I did. But anyway, finally a nurse came and put the stuff inside, used my PICC line, so that was all nice. And then the hour, and I'm pretty sure I fell asleep because it went by quite quickly. I don't have any idea what I dreamt about or anything. It was like that kind of in between where you're awake and asleep kind of thing. I don't know. Anyway, and then it was finally time for the scan, and that went fine. 20 minutes and it was fine. You just kind of lay there with your eyes closed and just wait for it to be over. At least it's quiet. Like the MRIs, they're noisy and bangy and like clankety clank noises, whereas the PET scan, it just kind of sounds like big whooshing sounds. And then I came out, and I'm glad I bought some crackers because I had to fast from 8 a.m. and by the time I actually went into the PET scan, I think it was like 4 or 4:30, something like that. So by the time I come out, I was quite hungry, but the sandwiches, they only had like meat with the sandwiches, and being neutropenic, I was kind of like, I won't eat that, so I just ate my crackers, which were fine. And then because it was so late, I missed my catch up with my doctor. However, she phoned me and we had a quick chat over the phone, and everything seems okay, and she seems reassured in terms of like my body and I don't know, the things I was saying. However, tomorrow for chemo, before I start chemo, she wants me to see her. So I think everything's fine, just a check-in. And then, so yeah, now I'm at the hospital. I've got a phone call at 11, so I've got about 45 minutes before I get this phone call from the radiotherapy. So I think they might have results from the PET scan, I'm not too sure. And then I have my gym session, and then after that a therapy session with my lovely therapist, and that's it. I'm feeling a little bit anxious about this phone call. But what can I do? Anyway, that's it for now. I'm gonna go get a blood test as well. I'm ready for chemo tomorrow, and I'll check in later maybe. Or this might be it for this video. I don't know. We'll see. Okay. Bye. Hello. Back in the car as usual. I've left the hospital and I got my phone call and they said that everything was like good. My PET scan was showing that I was responding well, and the plan was to do as what was discussed. So the 2 more months of, well, the 2 planned months of chemo and then the 3 weeks of radiation. And then I had, whilst I was on the phone, sorry, I got a text message from my nurse saying that my doctor still wanted to see me after my gym session. So I had my gym session, that was good. Had a little bit of a meltdown in there, so I was crying, but that was fine. Anyway, and then I went into the clinic to see my doctor, and she said for the most part I'm responding very well. However, so the one in my chest is responding very well and has shrunk a significant amount. However, the ones in my neck haven't shrunk as much as they'd hoped, or they haven't responded as well as they'd hoped. And the PET scan also showed a couple of high activity points in my groin area. So because of that, we're not 100% sure on what's going to happen. So the team, so the oncology team, the hematologist team and the radiotherapy team are having a meeting tomorrow to discuss the plan moving forward. So chemo has been cancelled for tomorrow, but I'll be having chemo on Friday. So we just have to wait and see. If at the meeting tomorrow they decide that no, we're not going to worry, she's responding well or whatever, then continue with the 2 months and the radiation. But if they might decide that they want to biopsy the area to, I don't know, determine whether it is the lymphoma or not, or they might just change the drugs or whatever so that it's a bit more of a stronger dose. But at the moment I'm not 100% sure what's happening moving forward, but I'll be receiving a phone call after 2 p.m. tomorrow to let me know what's going on. So that's it for now, and I guess I'll speak to you tomorrow. Hello, so I had my phone call earlier today about my PET scan results that they discussed at the lymphoma meeting, and they're generally happy with the results and how I'm responding. So we're going to continue treatment as planned, so the 2 months of chemo and the 3 weeks of radiation. As for the spots that showed up in my groin area, we think it's just cyst related, so some kind of little infection. So I'll be getting some antibiotics tomorrow, so whoopee. But that is now the end of this video, and I will see you in the next one, all about treatment 5, the beginning of cycle 3. So I'll see you all later. Bye.